Okay, Michael Scott, the attorney advisor at the Disability Rights Office and at the FCC. I hope you can turn on your screen real briefly. Okay, hi.
Hi. Well, I guess good morning to you, Jim, or late morning anyways. Sorry, it took a moment to get the voice interpreter so that I could hear what was going on.
My name is Jim House. I am the TDI board member representing the West region. And I am the moderator of this panel discussion. I hope we will have several questions, and maybe if time allows at the end, we will have some questions from the audience. Using the, using the Q&A, just type in your question there and we will monitor that. Okay. So here today, we'll be discussing video relay service. We talked about like the issues in the past with barriers and sound, but is it a perfect system today? What is your envision of the perfect VRS? We'll start with Zainab.
Hi, this is Zainab. Would you like me to continue or should I wait for the interpreter?
I'm concerned about full accessibility. Okay, well, we'll just go ahead because we have the voice interpreter and then we have the captioning. And then you can go ahead and sign, and then hopefully the interpreter will come in a few minutes. Sure, yeah. Happy to kick this off. My name is Zainab. That is a great question. We're thinking about where we are now with the video relay service system and where we need to get to and what's missing. For me to envision the perfect VRS system, a system where we have a communication equity as other users of telephone systems. That means the deaf user experience must be the equivalent of the non-deaf user experience, not close enough or almost that. No, it must be equivalent, which means we need a world with a robust competition and innovation, and we're not there yet. To be honest, right now, VRS is hit or miss. And honestly, when I connect to VRS calls, I kind of hope it knows to gamble every time that I use it. And we still don't have the skills-based routing. And we've been waiting for a long time for that. VRS service is stagnant. We have little to no technological innovations. Because it's been stagnated by rate cuts. They've been focused on fraud, waste, and abuse, FWA, on the causes. Fraud, waste, and abuse is a thing that happened in the past. It's time to move on. It's time to prioritize equivalence, equity. It's a must. Then also you have to consider the needs of deaf and blind and deaf with additional disabilities. And right now, VRS is not really accessible for many deaf, blind, and deaf plus individuals. So a perfect VRS means VRS that is truly accessible for all of us in the community, not just some of us. And then also a perfect VRS is where it intersects and we factor that into the equation. We have to expand the pool of diversity interpreters. No, most of the interpreters are white and they don't necessarily fit in with my background or my culture. They don't really fit with my voice, So we really need to expand the pool of VRS interpreters. And then also part of the vision of a perfect system is where we have no delays in signing up to receive the service. Right now, it's a very cumbersome experience. And in order to receive VRS service, we have to go through somebody that oversees it. And sometimes we have to wait a few days or weeks. Is that equivalent? No, it's not. A perfect VRS means that we can use captionings to verify the interpreter's voice and accuracy, rather than just assuming everything is going right or trying to lip read what the interpreter said. And sometimes the calls could be really totally missing the mark. So we don't really have that. There are critical gaps in VRS service. And to multiply that by COVID, at a time where people need to connect, they need that connection more than they've ever needed it before. So just to wrap this up, someone said something about last week about that that really struck a chord with me. A person said, COVID accelerated the need for teleconferencing, and it took away a lot of the video technology by 5 years. So from that to 1 year, wow. Wow, where's that level of innovation for VRS? Where is it? So that's where what we really need to figure out. How do we move from the past and focus on the future and how to get there. We need to, so that's why I think this is a great discussion, but we need not just to discuss, but take action. So those are my thoughts about what a perfect system is. Okay, thank you for your points, Zainab. We will be addressing some of these later in the discussion, but right now, Spencer, Montan, do you want to make any comments? Have to share? Sure. Hi, thank you. Thank you, Zainab. You made a lot of great points right now about the issues. Myself, as a deaf person, I tend to have a few phone numbers. I know I have a text number. I have one for personal, one for business, one for work. So I have several phone numbers, and it's really tough for me to manage all. I have to try to remember them and give out the right one. So I'm trying to figure out how do we reduce the number of phone numbers to make it easier for to hold and members, and that makes it easier to connect with my mailing address, with the people in my contact, as well as my video contacts. Everything is separate right now. So how can I manage all of these contacts? I missed one call, then I missed the other call. And I think the perfect vision of a VRS is probably to improve the geolocation for 911. The reason is because, I would log in, I fill out my home address, and okay, but if something happens, and I'm in an emergency at the food store, or I'm in a car accident, how would the emergency personnel identify and recognize my location? So that's why I think geolocation is very important to address and solve that issue right now. And then, so those are what I think for making what would make VRS a perfect system. Thank you, Spencer. And now we'll move on to Lance. Hi there. This is Lance signing right now. My sign name is Lance. So I think Zainab really, she answered a lot of these things very perfectly, about the world of what a perfect VRS would look like. And I agree with everything she says, everything Spencer said too. So I just want to add my imperfect answer to a perfect VRS and what that would look like. I think that we look at the world, hearing people use their phones to communicate, their devices. It seems very integrated in their lives, very ingrained. It's very smooth. They don't need to think about quality. They don't need to think about how do I make a call, or they don't have to think about how do I contact people. Just they just pick up their phone, push a button, boom. And I feel jealous. I mean, how deaf people, how we have to add on everything. We have to add on this. We have to worry about video quality. We have to worry about cost. We have to worry about all these sorts of things that hearing people don't need to think about. So they have right. I want the exact same equitable experience, and I want more. What I mean? I want it to be more seamless, more integrated. I don't want to think about. I don't want to think. I just want to make a call and connect with people, and I want to build these relationships with people. And I'll have to explain what VRS is, or explain all these things and make people confused. It should just become ingrained, and no different than the Spanish and other languages that Americans already embrace in their system. They already think about that. So that's one, the integration of VRS. And then the second one is we can't forget about interpreters. The interpreters on the other side of the call, if we wanted, we need to think about developing technology for them too. As a company, as a policymaker, as corporate, big tech companies, we need to think about the interpreter needs as well. Because I've noticed that during COVID or during all these the VRS industry, the interpreters became tired of the whole virtual, using technology at home, then they have to use it outside of their home. And so they're now working from home. So it's still not perfect for them. So we really need to advance the technology for both the deaf consumer and the interpreters. And that's my hope. This is Jim. And I hope Michael Scott has an interpreter now with him. Okay, great. All right, thank you. So I missed your introduction earlier. If you don't mind to briefly introduce yourself again and then respond to the first question about what a perfect VRS is. Is that all right?
Of course, that sounds fine. And
Mike, yes.
Great. So my name is Michael Scott, and I am an attorney advisor with the Disability Rights Office at the Federal Communications Commission. I've been there almost 5 years now. It'll be 5 years next August. So the perfect VRS system, I mean, it's always been hard to answer that question because everyone, has their differences, and there are a lot of different people that we need to try to have that system meet. And one of the questions the FCC looks at a lot is, should we be adding more forms of VRS to try to account for certain aspects, or like variances to accommodate people who are such as individuals who are deaf blind or deaf plus? Should we be looking at a completely different type of system, or should that be better integrated into VRS, and what would that look like? And as the regulatory agency, we end up having to turn to, who's doing the kind of innovation on the outside, what are we hearing from consumers about what's missing, and we have these forms for the input, and that's really the big question that we always look to. So I don't know if I can answer your question as to what it would look like, but I can say that we do want to help you get there, and we do spend a lot of time trying to get those inputs into those questions from consumers, from technologists, from industry, what it would look like, what needs to change. And then I suppose as an agency, we just need to be held better to account as to what steps we could keep doing to push things forward if there's something more we can be doing. Thanks.
Thank you. And the next question, what technological barriers do we see? Is there any technology out there that we can use? Like some of you mentioned geolocation, and that can help with helping 911 find out where you are. And then there's GPS, which can find the apartment building if you're in a high rise, and it finds you by address. But how do we improve this? Like on the Z-axis, that goes up. So at what floor, the elevation are you on? So that's another step that we need to add. But are there other technologies out there that we can take advantage of and built it in to VRS? I want to field that one off first. Maybe Spencer, want to start? Sure. All right. So we have to think about VRS as a relay service. So right now we're seeing communication services out there. The term that you might be familiar with is over the top, OTT. And it's like an app out there that, Skype, WhatsApp, all of those are communication service technologies out there. Is there a way that we can integrate this into the VRS platform? Would that benefit us as a deaf and hard of hearing consumer to not miss calls or communicate with their loved ones, their friends, using those platforms? This is Jim. Interesting. Lance, you wanted to say something? Hi, yes, Lance here, Lance signing. I want to think about the technological barriers of what technology is already out there. So I'm thinking of like FaceTime, Apple's FaceTime. And how can we integrate that with that? How do are there other messaging apps like Marco Polo, Facebook, WhatsApp? There's a lot of them out there. And how can we incorporate those into video? So, if hearing people can send a video message, and if a hearing person sends it to me through any of those apps, I'm not going to understand it. I have to add on, or have another person say, "Hey, what did this person say?" So that's where the gaps are. I think we're at a big mercy of big tech companies. I have to wait for the big tech company to develop something. VRS, TRS, policy, government regulation, that doesn't really allow a lot of space for experimentation. There's no real place for innovation. We just typically have to follow specific innovation things, what the FCC says or what the policy says. We need to provide this, so that's what we do. But it doesn't give us a lot of room for, well, what if? Why can't we do this? Let's dream about this. Can we improve this? So that's one. Yeah, that's my answer. This is Jim. Thank you. Zainab. Hi, Zainab speaking. Roger. So one missing piece from this, because that would be great, you know, if we had integration with FaceTime and other tools and messaging apps. But the problem is innovation is happening in that space without deaf people at the table. All this progress that's happening with VRS, all this progress that's happening with other video applications are operating in different silos. If we could bring everybody together into one, you know, if big tech companies took the, and you know, brought deaf people to the table and had this type of discussion, then I am sure we could make a lot of advancements. You know, NAD does a lot of great work with a lot of technological companies, and I applaud their work in this space, but we still have to recognize that there is still a long way to go. And how we can integrate this and build all this in, rather than just waiting on, you know, waiting for things to be deployed, or, you know, hey, what about me? You know, don't forget about us. No, we always have to remind them, you know, or we have to go back and address something. And we've been talking about this, you know, a perfect world for, you know, a perfect world is one where not just deaf people at the table, but instead of saying, no, oh, okay, well, that's a technological area. Okay, fine, whatever. We can't do everything. You know, we're stuck. We'll just keep things the same, follow the same status quo. No, no, no. Think outside the box. No, come on, let's try and address these things. And, you know, if everybody could share and pool resources, then no question, we could definitely escalate a lot more. Thank you, Michael. Do you have anything you want to add?
I will say to build off of kind of Lance and Zainab's points a little bit. I mean, part of the broader issue is that we don't have that full video integration anywhere. I mean, you still can't really communicate like Google Duo to FaceTime. It just, the technology doesn't cross yet. And we all believe it's possible, but we haven't figured out that next step. I mean, the FCC for its part had its North American Numbering Committee create a subgroup to look into this question. And, you know, it brought a great diverse group together to say, you know, we need interoperable video calling. How do we do it? How do we integrate VRS? How do we make sure 911 gets that video capability? Those were the questions we were looking at. And, you know, we have, that panel couldn't answer everything, but they got started. They got a good direction. They created some good documents. And, you know, the FCC needs to look at it, figure out its next steps on that. And the industry needs to look at it and figure out our next steps. What are we doing? Whether that's big tech, whether that's the telecom companies, whether that's the VRS companies. So, and that's what we keep, I guess we keep waiting for that next step. But I think we all need to get together and say, let's move forward. Let's take another step forward. I think those FCC panels that were created were a good step. I'd like to see more.
Yes, I agree. People within the deaf community should be at the table, and not only the FCC and other big corporations who develop video platforms. Okay, so now with progress, what barriers can the FCC and industry help remove, and how can we respond with the researchers and development, R&D, research and development? Do we need more outreach to consumers, to other companies? I mean, how could we, thoughts on this? Let's see. Michael, you want to start this off?
Yep. Yes, thank you. So, I mean, so procedurally, there's different kind of places and gaps you're looking at. It's, what needs to be the step forward taken by the FCC? Are there constituencies we're missing? Are there, how do we connect with them? How do we make sure that they're being reached? What do the VRS providers need to do that? What do they need for their next technological progress forward, where they can go? I mean, the FCC has spent a lot of time focused on correcting past issues of fraud, waste, and abuse. It's difficult to say, that's all in the past, because we have to be cognizant about it. We have to be watching for it. We have to make sure it doesn't happen again. It's, so we take our steps forward. We try to loosen up rules where we could. One change that took a long time to make, but was made, was at-home video calling. We started a pilot program. We got that off the ground, and that actually had very fortuitous timing, because then COVID happened, and all of a sudden we really need interpreters working in their homes, and all the providers actually had a small mechanism for building on what they had started in their trial programs, and that helped. And now the FCC, we have pending petitions to look at our next steps there, like how to change the rules we put in place on that if we need to. And those are all questions we're going to look to answer. And think of my next phrase here. The next thought I want to have is, there's never been a direct roadmap for us, because we get a lot of different questions and a lot of different directions and issues to address. And I think what's helpful, is when we hear from the consumers, from the individuals who can express, we have these, clear bottom line issues that we just need a better functionality, and then we can do things to try to address those, to make sure our minimum standards are up to par. One of the other issues that we've had the Disability Advisory Committee look at a few times is establishing metrics for understanding that if the service is functionally equivalent. We're still taking steps to improve interoperability, and having industry and technologists look to the question of, how can we improve the interoperability between these services? And then when we're looking at the question of how do we make everything interoperable, so that you can have VRS and have interoperable video calling and have those two things exist together. And there are other groups that are taking much more steps with that. And the FCC looks, and we have a little bit of funding that we've been able to make available for that in research and development. We have our rules that sometimes need to change. Sometimes they just are where they are because of our competing inputs. But we always welcome that additional feedback of what could we step in and help with, or what are we missing? What gap or connection haven't we made? And I know sometimes that everyone would like us to move a little faster, and we try to move as fast as we can, but it's kind of the questions that are before us and what we can answer and what we can act on. Thanks.
This is Jim here. Does anybody want to add? Hi, Lance. Hi, this is Lance. I really like what Michael Scott said. And I also want to commend the SCC. When COVID popped up, it was a lot of situations. How do we working from home? And the SCC was very proactive, and their response was very fast. So we were worried at first because, typically, things take time. Changes in policy typically take time. But during COVID, the FCC really stood up and helped and supported and allowed, and they waived some of these rules to allow us to be very successful as a VRS provider in this industry, and to provide interpreting needs for the deaf and hard of hearing community. I also want to look forward to the day when we can move beyond the abuse, fraud, waste, and abuse mentality that's been lingering for the last several years. A lot of discussions and considerations and rules were really develop to address fraud, waste, abuse. And I'm really would like to move to the past. No, I mean, yes, I agree. It's very important to prevent FWA, but at the same time, we need to encourage this type of innovation and progress in our journey. This is Jim. Thank you. Any other questions? Oh, Zainab, you have something? Hi, yes, this is Zainab. I just wanted to say that I recognize that the limitation that the FCC has and the bureaucracy can be a bit slow, and the need to develop a full record, on the issue. I recognize all of that. But I do want to say that I encourage the FCC to, like I said earlier, not just for tech companies, but also for the FCC to think outside the box and to be proactive rather than reactive. So that's just one thing I just wanted to add to that conversation. And like I said earlier, FWA, that's a thing in the past, is focused on innovation and the future. And speaking of the future, I did want to add a caveat to the previous discussion about technology and all this integration. Like all this interaction with FaceTime or personal conversation, yes, but I want to caution us, VRS, like using in virtual platforms, like on Zoom or Microsoft Teams and others, that is important as a backup option. No, there's no interpreter. No, okay, fine, use VRS. But I want to caution everyone just to be careful, because I don't want the entities who already have a existing legal obligation and to take advantage of, oh, we can use VRS. Oh, perfect. I don't need that. Bring in an interpreter and pay for the, no. It's important to still have this. It's important to have interpreters involved because they know the correct terminology, whereas VR interpreters, they handle a variety of self. So for those who have formal, telehealth appointments, so those are in a formal context or an informal. If you have a work meeting with 5 people calling in, 5 deaf people calling in, and if all of them to use VRS, whoa, that's an unnecessary waste of the funds. It's going to deplete the fund quickly, and we need to keep the fund very healthy. So I just want to be careful about, what these integrations are great, but when is it appropriate for that and when is it not appropriate? One real nice thing that we haven't really discussed yet is integrating VRS with multiplayer games, MPGs, where players, they speak with each other through gaming. That would be an awesome for deaf players to have and to use VRS in that space. That would be a that would be a game changer. No pun intended. So I just want to add that. Or is that a pun? I think it's important to have that collaboration with all of these, have that MPOS, like have a policy that benefits for all of deaf and hard of hearing people, to make sure that policies have a inclusive design, make sure that the product is accessible from the beginning rather than later, when you start from day one, when you start building it out. So our community is responsible to roll up our sleeves and work with us and push them. And I know that corporations have their own timeline. I know they have their own goals, but it's really important to work together and work with the community. And as an educational university, we do case studies. We collect feedback and surveys, focus groups, and dialogue with deaf and hard of hearing community. So we collect all of this, and then we can share it with FCC and other organizations. So it's very important to have this type of collaboration. This is Jim. Thank you. Yes, I know in the past several years, during COVID, everybody had to stay home, and we had to change a lot of the rules related with relay services. Those rules probably will dissipate when COVID is over. but which rules do we want to keep? No, it's good. No, they removed something, but some rules, do we rather go back to the pre-COVID rules? So which rules would you like to see, and which temporary waivers would you like to keep? Lance? Hi, this is Lance. Which rules to keep? Really, I feel that, well, I'm thinking about the interpreters. But because of COVID, it caused a lot of interpreters to work from home. And that created a good decision, and it gave interpreters more options. They don't have to drive to work. They don't have to go to different place. They can just stay home and support. So we need to make sure that those type of rules are still in place, that interpreters are able to work from home, that their environments are safe, private. No, we don't allow third party or eavesdropping or anything. And I remember before, the FCC had a rule about limiting the number of interpreters that can work from home. And they expanded that number. And I think we should keep that expansion going forward. I also think that, well, it's not a rule related, but related to the community has shifted their communication methods, that, Microsoft Teams and Zooms. I think that's here to stay. I think we should promote and encourage that type of technology. But I agree with what Zainab said. We cannot allow that to become a replacement for critical in-person interpreting needs. We've noticed that there are some situations where organizations or out there that start to look, oh, well, this is cheaper, I'll just go ahead and use this and not have to hire an interpreter. And that's not the right approach at all. It's not. We should have a balance that should make what's appropriate for Zoom calls and what's appropriate for in person. So we need to do some type of outreach and education to educate the community to keep in mind the needs of the deaf and hard to hear community. So that's another area I just wanted to support Zainab's statements about how the ADA law and the way everything is set up is creating a it's creates focus on cost, and it shouldn't be like that. So like doctors, schools, hospitals, and everything, when they think about interpreters, they think about cost, and we need to figure out a way how to remove that mentality. We need to be able to provide the services without having to always go for the cheapest agency or the cheapest interpreters. Just look about the quality, get the right interpreter. And sorry for going off, but I just wanted to mention that as well. This is Jim. Zainab, do you want to add? Hi, yes, this is Zainab speaking. So two things about COVID specifically, and then I want to address Lance's last point about the unnecessary focus on cost. So it's important, yes, but it's also related in the ways that I wanted to expand on that some more. Firstly, related with COVID, I want to commend the FCC. I mean, well, we were talking about the need to be proactive. The FCC was quick right off the bat. Once COVID hit, and started, people started staying home and social distancing. The FCC quickly made a lot of waivers to minimize the disruption of the relay service system. So I really want to applaud them for that. For example, like the at-home interpreting. I mean, we were initially very concerned about this, even before COVID, with the whole pilot program because of privacy and disruption of broadband at home. But at-home interpreters, what their environment is like. But since COVID, these interpreters and with these security measures in place, it really grew the pool of available interpreters, and we were able to continue to have an accessible video relay system during that. So I really want to acknowledge and commend them for that. And then now Lance's point about the unnecessary focus on cost. Yes, absolutely, you are correct. NAD has proposed in several contexts a communication access fund and a communication reasonable accommodation fund. So these two, one for general, doctors' offices, lawyers, and then the other for employment. And then the idea is that instead of that person, that company, that office, that hospital, having to worry so much about costs and interpreters, the expenses, and denying that person access that they need, if they were to have a centralized fund for interpreters, that would remove that whole thing about cost and disincentivize these providers to provide interpreters. So I think that would really greatly help tremendously with dissipating, resolving a lot of those issues. So I just want to add that. I know it's a little off the point, but no, there are really a lot of issues in that space. And I just wanted to address that. This is Jim. Yes, there's a lot of overlapping. Okay. Spencer. Yes, this is Spencer. So I just wanted to quickly explain about the video number. Well, we were working on a project for the past couple of years, this concept called IRIS, I-R-I-S. And it's named after a Greek god of messenger. We want your mobile device to have full access as a hearing non-deaf person's device. So that means you would have one number which integrates with your dialer system. So by going into accessibility settings, you can turn, like your VRS and your CTS calls, you can have the option to call, communicate with these people, your loved ones. And we are actually developing a prototype right now here at the CAT, the Center of Access Technology. We have a lot of different projects we're working on, but this one, particularly Project IRIS, is the most exciting that we're hoping. And we're hoping that this project will fit the needs of the VRS and the industry out there. Hopefully it will lessen missed calls, and we can integrate with your address book, your contact list. So we want to empower consumers to decide what type of relay settings that they want on their platform. This is Jim, thank you. One more, Zainab, just one more. Yes, just one more quick thing I wanted to add to Spencer, the point about that one number for everything. Just to share from a deaf and hard of hearing consumer perspective, for NAD, that would be absolutely beneficial for all of these deaf and hard of hearing consumers. Often I have to give out 2 or 3 different phone numbers. For example, my doctor's office, I tend to give, this is my text number because they tend to send me, appointment reminders and notifications to confirm. And then I have to give them my VP, my VRS number, in case they want to call me and have some more discussions about my appointment. So just to discuss anything about on the call. So I have to give these 2 numbers, and that's really annoying. If I could just be able to combine these into one number, that would be a huge benefit. And I just wanted to add to that. Michael, do you want to add anything to that?
So it's difficult for me to jump in on that. To go back to your original question, in terms of what rules the FCC should keep or not keep, we have some pending petitions before us about making some COVID changes permanent, and those are out for comment, and the FCC is looking at those questions. I think generally we are open to making having the technology be better. The FCC's mandate is fairly limited. We have, in terms of, we oversee the VRS aspect of it, and then you have the whole other aspect of, when you have these group video calls, who's putting on that call, whose responsibility is it to make sure there are interpreters? So that begins to fall outside the FCC's jurisdiction, and it falls to the Department of Justice to make sure people are providing the appropriate accommodations and and the right work and the right places. And then, you get into various workplace questions, which then kind of dovetail into different jurisdictions. So like there are certain things the FCC can focus in on and promote and be a part of, and there are other things that just fall outside of what Congress has told us we can do.
Okay, how much time do we have left? Let me check my time clock. Oh, I know we have a few questions from the audience, but how do you get a interpreter to stop saying, this person's used a sign language? So how do we, just start the call without addressing that? So anybody want to say that? I've experienced this before, as I call, once you join, just tell the interpreter at the very beginning, and the interpreter will follow what you say. Thank you. Thank you, Spence. Lance, a quick response. Yes. I have mixed feelings about this because some deaf people want the interpreter to introduce, because hearing people can sometimes be confused with the voicing. I know this is a male deaf signer, but it sounds like a female. So my suggestion is right before the interpreter makes the call, let the interpreter know, like what Spencer said, just tell the interpreter, I don't want to be introduced. And the interpreter typically will always honor that request. This is Jim. Yes, and you also have the right to change the interpreter according to your gender preference if they're available. Lance, yes, that's correct here. Okay. Someone's asking about, since we have caption, let me read that. Okay. Do you plan to have a pilot program that has a deaf interpreter on the VRS call? What happened to that pilot program? What happened to that concept? Hi, this is Zainab signing. I'd be happy to take the lead on that one. NAD, TDI, CPADO, which is a C3 plus deaf organization. We've all been advocating for that. We're all part of a coalition called DHHCAN, Deaf and Hard of Hearing Consumers Advocacy Network, and I am chair of that. And so we get together, we've been advocating for this for a long time with the FCC to have deaf interpreters in the VRS environment. I mentioned earlier that Deaf Plus, Deaf Plus with CP, do not have communication equity at all in VRS. They don't have the same experience. A lot of these interpreters sometimes would have a hard time understanding what, like for example, a person with cerebral palsy. So their mobile restrictions sometimes make it harder for the interpreter to understand. And so that's why we need to have a deaf interpreter there so that they can support. And we've been asking for this for a long time. I mean, it still hasn't happened yet. It's been several years now. So, I mean, yeah, we're still waiting for it. Someone asked how many interpreters out there. I don't know how you can define that. I mean, I don't know the exact answer, but there's about 8,000 to 10,000 VRS interpreters, but not all of them work full time. Some of them are only, a few hours a week. or as a supplementary income, and then others work in the community. So not all of feel full-time, but most interpreters I have already worked in VRS industry at one point in their career. So I think most of them have experienced the VRS type of call, yes. Okay, so thank you very much, everybody. Okay, we are right out of time right now, so thank you very much. Here's the link to go back to the main room. Thank you, everybody. Thank you for your time. Thank you. Bye-bye. Bye-bye. Bye-bye.